Good afternoon. My name is Alden Landry. I'm the Assistant Dean for the Office for Diversity, Inclusion, and Community Partnership here at Harvard Medical School, as well as I'm an Associate Professor of Emergency Medicine at Beth Israel Medical Center. I want to welcome you today to today's webinar on physical medicine and rehab residency opportunities at the Harvard-affiliated hospitals. Today's program is part of the Office for Diversity, Inclusion, and Community Partnerships Visiting Clerkship program. The mission of the DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure health equity locally, nationally, and globally. The DICP efforts support the career development of students, trainees, and junior faculty, identify and train leaders in academic medicine and health policy, and provide programs that address crucial pipeline issues. Under this umbrella, the BCP has been a model for excellence, offering outstanding medical students, particularly those coming from groups underrepresented in medicine and those showing a commitment to addressing issues in inequity in healthcare, an opportunity to participate in externships at HMS and its affiliated hospitals. Since its beginning in 1991, over 1,600 students have completed our program. And as part of our outreach, we also host a series of webinars each year to bring members of the HMS residency program community together with medical students to share ideas, provide support, and address questions on the transition to the next stage of training. The webinars provide an opportunity to discuss the application process, address questions from students about away rotations, as well as other concerns that students may have. This year's webinars have focused on ophthalmology, orthopedics, and now physical medicine and rehab. For a couple housekeeping notes, this webinar is being recorded and a copy will be sent to all participants in addition to being posted on our DICP website. The chat function has been turned off. However, if you do have a question, please be sure to ask it in the Q&A section. Also, a short survey will be posted at the end of each webinar, and we ask you to take a moment to complete that before signing off. Now I want to introduce our panelists who are going to really be helping to shape this discussion. So first is Dr. Dorothy Tolchin, who is the Director of Medical Student Education for the HMS Spalding Rehab Hospital, Mass General Brigham Department of Physical Medicine and Rehabilitation, and the head of the PM&R Career Advisor Group at Harvard Medical School. She is an active member of the Medical Student Educators Council of the Association of Academic Physiatrists. Dr. Tolchin regularly advises and mentors students exploring opportunities or pursuing careers in PM&R, both at Harvard and nationally. She loves to talk about her work and working with students and welcomes any questions. Next is Dr. Ashwin Babu, who is an Associate Program Director for the Harvard Spalding PM&R Residency Training Program. He is a physiatrist who specializes in non-surgical management of sports injuries. He serves as the team physician for the Boston Bruins, the New England Revolution, and the USA CP soccer team. He also serves as a consultant for the New England Patriots, Harvard University, Suffolk University, and Curry College. So with that, I want to turn it over to you, Ashwin, and first tell us about your program.
Thank you so much, Dr. Landry, for the introduction and so much for having all of us here so we can talk a little bit about our program and everything that we do here in terms of physiatry over at HMS. And so we have a great program that we're really very, very proud of. We kind of, the way we've thought about putting this whole thing together is making sure that our students have access to everything within physiatry that they could possibly want access to and have all the resources available to kind of develop their own niche to become kind of leaders in that particular area. The thing with PM&R is that it's such an incredibly broad field with so many different facets, and two different physiatrists can have incredibly different careers, yet still have the same core residency training. And so the goal for our program really is to reflect that and make sure that our trainees have all that they, have access to all that PM&R has to offer. Pardon me. So I think that's kind of the main overview of our program to mention, and we'll obviously go into a little more specifics as this goes forward. Dorothy, anything to add to that? Awesome. So everyone here obviously will be already aware of what physiatry is, but just to make sure we're all on the same page here. So PM&R's medical specialty really focuses on caring for individuals with some kind of illness or injury that impairs their ability to function. And a bolded function here, because that really is the calling part of the physiatrist. The main thing that ties all different physiatrists together is that their focus is on function and making sure that their patients are able to get back to what they want to be able to do or what they need to be able to do to live full lives. And so, there's a really broad field. It's a very broad field and lots of different facets. And there's two main ways to think about it for the most part is some folks are a little more inpatient based, some folks are a little more outpatient based, although there certainly is crossover. These are just a general way to think about it. On the inpatient side, there's the classic kind of rotations that Spaulding has dedicated floors to treating these patients. So traumatic brain injury, stroke, spinal cord injury, general rehab, or what we call medically complex, and then pediatrics. And there certainly are more than this. This is just the kind of most common categories that you'll see. On the outpatient side, there's also a large number of different facets that people can go into, but the most commonly spoken of are things in pain or spine medicine, sports medicine, which is my subspecialty, neuromuscular medicine, and certainly others. And so I tell this just to make sure that we are all kind of starting from the same page here, because we have, folks who are interested in physiatry who really thought they were going to do, for instance, orthopedics, because they really liked the musculoskeletal side of medicine. And certainly physiatry, there's lots of overlap there. We have other folks who are more interested in neurology and for instance, traumatic brain injury world. And there's lots of overlap there and really everything in between. So if we can go to the next slide, we can talk a little bit more about our program in particular. And so, residency training is really an incredible time. It goes by so fast. The way all physiatry programs really work is that it's 3 years of advanced training with a 1 year of an internship. The internship is most commonly done in internal medicine. The next most common to be transitional years. Every once in a while, we'll have folks who do a pediatrics or general surgery internship, although that's certainly not the most common. And after you finish your intern year, then there's 3 years of advanced training. For the most part, using broad strokes, most programs have about a 50-50 split between inpatient and outpatient. There are rules kind of dictated to us by the board of PM&R that tells us how much inpatient that one needs to have. Overall, our program has 4 months of elective. This varies. This is about as much as one can have, again, within the confines of the ABPM&R rules. And another question that kind of comes up is call. And call in physiatry is really quite gentle as far as these things go. It's usually about weekly as a PGY2, depending on the size of the program and where you go. At our institution, we have 8 residents a year for 3 years, and the call is loaded much more heavy as on your PGY2 year. And so usually people are on call roughly weekly as a 2, and then it certainly drops off dramatically. By the time you're PGY4, you're never doing any overnight call in our program. There's just occasional kind of what we call admit call that you'll be doing every once in a while. Physiatry training is quite heavy on procedurally, certainly some programs more than others. We do have quite a bit of procedural training. The most commonly discussed procedures that are done from physiatry training are ultrasound guided injections and diagnostic ultrasound procedures. That's a subspecialty mine. That's what I teach all the trainees. You can see an image of one of our didactic sessions on the bottom right picture there. The other side is spine interventions. So injections for lower back or neck pain. You can kind of see that in the middle picture there. And then EMGs is another one. So EMG stands for electromyography. This is a study where we kind of test how nerves and muscles are functioning from a neurologic standpoint, and all of our residents get adequate numbers to make sure they can pass their boards and do all the subspecialty training that's necessary. The next thing that we pride ourselves on in our program is research opportunities. And so as part of MGB, there comes all the resources and the kind of connections associated with that. And there really is quite a lot here. In fact, these maybe not the most scientifically rigorous thing in the world, but in the doximity rankings and everything, our program is always on, if not the top, one of the few top programs in terms of research output. It's something that we prioritize, making sure that research education is very well done in our program and making sure that the trainees have all the opportunities to pursue whatever interests that they have. I work with a couple of our other colleagues to kind of really focus on the research side of our resident training program. We've gone so far as to build like an internal grant to kind of get our young residents who are really interested in a research career practice in writing grants, so that by the time they're graduating from our program, they're ready to go for K awards and really build an independent research career. In terms of the actual rotations, we are very well situated at Spalding to have access to kind of everything through the HMS kind of spectrum. That basically involves the main sites that you're at is our rehab specific hospital, which is a standalone rehab institution. And that's, of course, the Spalding Rehab Hospital in Charlestown. And there's lots of other sites that we go. Our philosophy in our program is we want to take our trainees and put them wherever the best educational environment is, kind of no matter where it is. If we have access to it and it's a good educational opportunity, we want to find a way to get our trainees there. And because of that, we have folks at Mass General, at Brigham, at Faulkner, at Foxborough, and Newton Wellesley, Spalding, Cambridge, all over the place. We're a rather spread apart training program because we will seek whatever the best educational opportunity is. And so that's really another thing that I always like to make mention of is you want to be, you're obviously here to learn, and we want to make sure that you're learning from the very best there is. And so our faculty over at Spalding is really quite impressive. We have national and international leaders in all facets of physiatry, people who are regularly presenting posters at conferences, being asked to speak on their work all around the country. And so these are the folks that you'll be kind of learning from one-on-one. Particular areas of strength in our program that I always like to draw attention to for trainees is I just like to say the proof's in the pudding. When you look at how well our trainees are trained, they look at the next step as to how well are they prepared to go out into independent practice and to get the fellowships that they want. Fellowships in PM&R vary in level of competitiveness. Sports medicine tends to be quite competitive. Pain medicine tends to be quite competitive. Some of the other ones may be less so. But the fact of the matter is even in the quote unquote less competitive subspecialties, the top several programs are usually quite competitive. And so when you look at our track record of where we're able to take our residents and place them around the country, it's really quite impressive and something that we're very proud of. And we want to make sure that if there's an area where we find trainees aren't necessarily gravitating towards or aren't having quite as good a track record, we put some attention there to make sure we're able to get people where they want to be. And that's on the fellowship side where, obviously there's a match program in many cases. The other side of things, of course, is job placement. And sometimes trainees come to us with really specific areas of interest around the country, for instance, for family reasons or others. And our ability to find folks jobs where they need to be is something that we put a lot of time and effort towards. The next draw that we commonly hear, and this is directly a feedback question. We make sure that we encourage our students when they're applying for our residency program to ask our residents, what do you like? What do you not like? Make sure you get all the information you need. And the feedback that we hear very commonly is one of the best things about the program. It's really the camaraderie and the kind of family atmosphere that we have within our department. And really that comes from the top down. So our chair, Ross Safant, our program director, Kevin O'Connor, and the other associate program director, Craig Revito, all have done a really impressive job at really encouraging and facilitating a very family-like atmosphere. People are always encouraged to reach out for help, support, whatever is necessary. And so and the residents themselves are always very, very close. Getting pictures like this of residents doing things together is super, super easy. They're all over the place. They're constantly doing things, some that we help kind of put together. For instance, we have resident retreats and some things that I just find out about later. I'm like, you guys did what? Man, that sounds like fun. So the residents really get along great. And it's a big, big draw for the program. The last thing that I mentioned, I've kind of already mentioned a few times, is our goal. The way I like to tell people is our program is designed to be like drinking from a fire hose. There is more opportunity than you can go through in one 3-year residency training program. It's that way by design. The goal is to take very, very hungry and academically strong and hardworking residents, give them all the opportunities that they need and let them go nuts. And so there's lots of opportunities for research, leadership development, everything that we need to get you become the best physiatrist that you can be. I'll take the next slide, please. So quickly, we'll just go through some of the characteristics of a successful applicant. And really all the programs around the country, really, we're looking for medical students who are bright, who are hardworking, who work well in teams, who've developed and demonstrated good leadership skills, and folks who really understand the physiatry mindset, which really is the first two things, right? Working in teams, focusing on function of your patients, and understanding how physiatry fits into their overall plans. One thing that we sometimes will get is folks who are interested in physiatry, but haven't really taken the time to peek under the hood, and they don't really have a good understanding of what truly physiatry is, and that sometimes comes out in the application. And so most folks are a little leery about folks there, and sometimes it isn't exactly the right field for them. And so making sure that folks have that true understanding is very instructive. Applicants who are highly sought after often have done very well across the broad. PM&R is so broad. You'll be doing a rotation looking at brain injured patients on the inpatient side 1 month, and next month you'll be seeing high level collegiate athletes with me the next. And that transition is really quite broad. And so what we look for is folks who do well across a broad spectrum of medical student rotations. It kind of demonstrates that they have the flexibility of mindset necessary to succeed in physiatry. We're also looking for strong letters of recommendation from physiatrists who can kind of speak to their ability to fit into the PM&R world. We also, we're a very academically rigorous program, and so we're looking for folks with a strong research background, or at least a basic research background, kind of folks who have explored research and have some basic understanding. Of course, we will teach you a lot of the advanced skills necessary, but we like to look for folks who have at least kind of peeked under that hood. And then finally, people who've taken the time to look at the different facets of PM&R. So it's obviously there's a lot of variability in what people have access to in PM&R, but we want to be able to understand that there's an inpatient side, an outpatient side, neuro rehab, look under a bunch of different areas to make sure it's the right field. Dorothy, I want to stop here. And anything that you want to tack on to this slide in particular?
Thanks, Ashwin. That was great. The other thing that has been coming to mind as you've been sharing these slides is the element of medical education and sustainability of medical education across our learner trajectory, both in our program and other programs. So in our program, we pay a lot of attention to fostering our residents' ability to then become teachers, which they will in just a few short years. And so we carefully integrate our medical students onto services and ensure that we're helping our residents learn how to be high quality didactic and clinical educators as well. So that's something important in all of the, particularly the larger PM&R programs, but I think in all PM&R programs, and something that we look for in our applicants too, in terms of their excitement for and enthusiasm for learning and also for teaching.
So I think that's kind of the main things to chat about. And then maybe we can take some questions and we can kind of take it from there.
Awesome. Thank you for that. I almost feel like I am ready to apply to PM&R and make a specialty change after that presentation. So thank you for that. Ashwin, I want to stick with you for the first question. And from a program director's perspective, what are your overall thoughts about this application season and how it will be similar and different compared to years prior?
Sure. Yeah, that's a great question. So I think certainly more similarities than differences. I think while it's still being discussed at the highest levels, for the most part, it seems likely we'll be doing, if not exclusively, a high number of virtual interviews for our residency training programs. I believe it's already been decided for the sports fellowships. And so the point is that that's what we did last year, and it's likely what we'll be doing again. The biggest differences this year is, PM&R had their first year of using the location and the program signals. And so now all the residency programs kind of have a practice run, right? They've all done it once. They understand what those signals mean and how to utilize it in creating their rank list. And so we'll have maybe a little more refined way to think about this. The other thing, of course, is that folks will not have step one scores available quite as commonly as they have in years past. So that will be a slight difference from several years ago. But for the most part, it'll be pretty similar from our perspective, at least.
And for you, Dorothy, as you are advising students, what are some of the student concerns that you're hearing about this year's upcoming application cycle?
Yeah, great question. I think students are still trying to figure out how to learn best about a program and its location, especially programs with lots of sites when they're not visiting. So that's something that we talk about a fair amount. And as Ashwin talked about, one of the best ways to learn about programs is to talk to residents who have their feet on the ground, who are experiencing it. And so we highly recommend that students connect with programs, ask to connect with residents at various programs, and ask them their true, honest questions, as many as they have.
And so I think one of the things that's important, at least for me and many of the students that are going to be watching this, is your program's efforts to advance diversity, equity, and inclusion. And maybe both of you can offer some insights on your thoughts about how your residency program has been, putting forth effort to advance DEI.
Yeah, so I can start. A lot is the short answer. It's certainly been a priority for us for many years, and certainly the last several years in particular, we've been involved with some very, very cool programs. So one of the ones that I like to speak about and really most proud of is really an entirely resident derived group that has gotten like support and funding through the department and the hospital, and we've kind of run with it. And so this is what we call a READY committee. It's a residents empowering and advocating for diversity and inclusion, and so READI. And basically, this is a resident led group that goes about doing several ways to advance the DEI services through our institution. So the first of which, that I'll speak about through the residency application season, is they hold very specific webinars where they talk about a particular topic, and then they have kind of a more informal Q&A for applicants so they can kind of meet some of the folks who are part of this program and ask their very honest questions about what things are like at Spalding and see where there's challenges, where we're making improvements, where things are changing. And so that's really, that's one of the most important things that we have. And then they also do a lot of community outreach projects, and and they're getting involved with the DEI efforts through the Spalding system and Mass General Brigham more globally, and we're making sure that they have resident representation in these committees so that all the efforts are being kind of aligned and working the same way. And this is basically one program where we, always make sure it has the funding they need, has the leadership that they need, so that we can really let them do this. And it's been an incredible demonstration of when residents are really excited about a topic, just how much they can accomplish. I mean, we keep our residents pretty busy for the most part, but they still find so much time to do so much impressive work. And they've gone to local high schools to kind of talk about medicine and making sure that medicine feels like a very viable and legitimate career choice from folks from a variety of backgrounds, and all manner of other things, celebrating different cultural events throughout the year, raising awareness about that. It's really been a remarkable group. And so let me stop there. Dorothy, you want to add anything to that? I'll leave that to you.
Yeah, no, I would echo that. It's been a really phenomenal opportunity and experience to work with and watch the residents as they lead these efforts, and also to see how well they're supported by our faculty and administration who care deeply and sincerely about these efforts being successful. And I've been really proud of our program for how far we've come and how much work we continue to do.
And I think another it's just an emphasis to say is that we make sure that when we're going through this interview cycle and this application cycle, we're making sure that we kind of address these concerns directly, and we put it out for up front and center. And this is the efforts. Here's what we're doing to kind of make sure that everyone, for a variety of their background, feels welcome and included here. And it's instead of just this is our program, this is what it is. This is trying to make sure that we take that extra step to make sure during the interview cycle that we're making sure these efforts are front and center.
Awesome. So Dorothy, I want to come to you for this question, which is that we're going to have some people who are watching this who may be earlier on in their medical school journey, first, second year students. They're not the third year students or the fourth year students who are in that application, who are in the process of going through the application process right now. How do students learn about PM&R? How do they decide if this is the right specialty for them?
There are a few ways that folks come to PM&R. I'll start with thinking about, once you know that PM&R exists, then you're trying to decide, is this the right specialty for me? I think it's important to think about the questions as a student that you're asking about your patients. So if you find yourself seeing a patient in acute care and wondering what's going to happen to this patient after they leave the hospital, or how is this patient going to return to their former job now that they function in a different way? Or how can we help this person to be independent? These kinds of questions are well supported in a career in PM&R, and I would suggest lead you to explore PM&R a little bit more. Do some shadowing on PM&R services, enroll in PM&R clerkships, and see if you find that you feel like this is your home, that the folks around you are thinking about the same questions, are excited about the same kinds of things as you are. Particularly in inpatient PM&R, we're working really hard to help optimize patients' function, but we are not always focused on sort of curing a particular diagnosis or fixing something or making something go away, but rather supporting our patients and living the best possible lives they can. And if you find that that mindset and philosophy aligns with the way that you think about your patients, then PM&R might be a good fit for you. In many cases, students don't learn about PM&R till relatively late in their medical school careers. Most schools do not have a required PM&R rotation, for example, and PM&R is a small subspecialty. So most students don't necessarily have friends or colleagues or peers who've come before them who've gone into PM&R to talk about it. So if you come to PM&R on the late side and you don't have an opportunity to do a full-on clerkship, again, the same resources that we've been talking about. Explore, reach out to folks in your department. If your school does not have a department of PM&R, you can always reach out to Ashwin and me, but please feel comfortable sending an email and introducing yourself and asking if you can talk about PM&R. Those of us in PM&R are always very excited to talk to students who also want to jump into the field. So it's important to be proactive, to share sort of where you are on your trajectory. I think the final point I'll make about interest in PM&R and exploring your interest in PM&R is thinking about our patient populations. And so if you want to see if working with our patient populations excites you, then there may be extracurricular opportunities. For example, volunteering in a program with adaptive sports or with Paralympics or with Special Olympics, for example, and working with patients with various range of impairment and disability. If you find that satisfying and exciting, if you find that there are challenges to be solved and you want to be part of solving those challenges, then again, PM&R may be the place for you clinically and also to use your platform as a clinician to be an advocate more broadly. Ashwin, do you have other thoughts on finding PM&R?
Yeah, I think you hit it right on the head. I think the point is when you're if you're a student at a program where there isn't a physiatry department, find one. So you know what I mean. And everyone who's in PM&R knows this. And we've all met a student who is incredibly bright, incredibly dedicated, and would be a terrific physiatrist if only they had the opportunity. We're excited to find those folks and get them in the right place. And so we've, Dorothy and I have talked about this for years, but we like to think of, HMS as we know that there's great medical schools nearby that don't have a PM&R department. And we like to think of ourselves as a beacon for this kind of thinking and this kind of field here and in the country and everywhere else. And so there are a lot of great programs that do have, there are a lot of great med schools that do have psychiatry departments. So reach out to any of them. And again, a simple introductory email. Almost every, but certainly the most, kind of the biggest programs will have a Dorothy, right? And somebody who's in charge of medical student education, and get in touch with them and they will get you in the right hands. And then Dorothy will get you to everyone else that you need. And we'll make sure we get a good experience for you. Because when we have, when finding that student who didn't have the opportunity, but now reached out and found it is very, very rewarding for all of us.
So I want to go back to a point that Dorothy mentioned and maybe ask you, Ashwin, about your thoughts on this. A lot of students don't get exposure to PM&R during their clerkship, their traditional clerkship phase. And it's not until they would do this in elective time or towards their fourth year. And so what are the things that a student needs to make sure that they have on their application, specifically when it comes to clerkships, that's going to be helpful for them when they are applying to PM&R? So
I'll start, Dorothy, and then So this happens every year. We understand, right? This is unfortunately a quite common thing that comes up. Someone kind of hears about PM&R middle to end of third year, and they've already got everything lined up for a internal medicine application, for instance, or a neurology application. They kind of passing hear about PM&R, they do more exploring, they're very curious about it. And at some point they change their mind and say, I'm going to apply to PM&R, but they're worried about if their application has all the things that I kind of talked about, exposure to different kinds of field. And so those cases, to me, what's most important is that you put the effort forward to try to find what you can, right? Shadow where you can, reach out to who you're able to. And in your application, in the personal statement section or in the supplemental application, this is a terrific place to kind of explain this thought process that, I have, this isn't just something that came across randomly last minute. I have thought about physiatry. This is something that I'm interested in. Here's what I've done so far. And here's why this is the right field for me. To me, those applications are really quite compelling. And because we do understand sometimes that's just the way it is. The second thing that I mentioned is, what we're looking for really is excellence across a variety of different rotations, because physiatry does have a little bit of internal medicine, a little bit of neurology, a little bit of orthopedics, a little bit of neurosurgery. And so learning all of these different elements and excelling in all of these different areas really is quite compelling as a student. And so, just because you don't have 4 PM&R electives doesn't mean you don't have a chance. It just means you have to put a little effort in other areas to kind of demonstrate this is the story that happens. And again, remember, every year we see this, and it's not a big deal.
100%. I would add one additional piece, which is for applicants who are coming to PM&R later and haven't had that experience, is to be really thoughtful about your recommenders who you're asking for your letters of recommendation. And also feel comfortable proactively asking if perhaps they could comment on certain things that are important to PM&R. So as Ashwin talked about, there's certain characteristics we need physiatrists to be really good team players. We need physiatrists to be really good communicators, and particularly across settings of care. So between the acute care hospital and the rehab hospital, how are we going to communicate? How are we going to involve people on our teams? We want our residents to be really good at taking the long view and thinking about how do we take care of our patients over time and those kinds of things. So one letter, recommenders, those who write your letters of recommendation, when they can comment on those specific skill sets, that's also really relevant and important in PM&R.
And we'll talk a little bit more about letters of recommendation. Thank you for that lead in. A question for you, Dorothy, is we at the VCP, I encourage students to come and rotate with us. We think there's a lot of value added in away rotations. Hearing that most students don't have that exposure to PM&R during their, traditional clerkship exposures and rotations. Is there value in doing away rotations in PM&R and coming up and rotating with us at one of our teaching hospitals?
Absolutely. Our medical students have the opportunity during our clerkships to experience any and all of the settings that Ashwin talked about that our residents are able to experience. So we highly encourage and welcome students to apply to participate. We offer 2 clerkships based out of our Department of PM&R. One is called Introduction to PM&R, which is essentially our adult PM&R clerkship. And then we have a pediatric rehabilitation clerkship, which is focused on peds. Ashwin, other things you'd like to add about clerkships?
No, I think it's well said. I think, the question that commonly comes up is, I think I'm interested at Spalding, do I have to do a rotation here in order to get ranked to match? And the answer is no. The clerkship is for the student. It is, we love to have students here who are bright and interested, and we love to kind of work with them, and that will certainly factor into an overall application. But it is not a requisite. We do not rank our list just from our rotators at all. The goal of the rotation is to educate as many med students as we can get our hands on about PM&R. That is the purpose of the rotation. It's for you guys. We will take what we can get and we'll help the way we can. But please understand, it is not necessary for a good rank.
And I think part of the importance of visiting clerkship programs is to learn about the programs that they may be applying to. And it's good to hear that, that rank list is not determined by if you rotated with us or not. But students want to learn more about programs, and sometimes they're not able to rotate with us. What's the best way for students to learn more about a PM&R residency program, specifically ours? Is it to reach out to faculty? Is it to reach out to individuals like yourselves? Is it to reach out to the trainees? Where's the best source of information that students can go to find information about our residency program?
So kind of all of the above, actually, because there's different kind of tiers of information that people need to get. And so a lot of the basic information about rotations and where they are, that sort of stuff, a lot of it's on our website. And so certainly, we've put efforts to make sure that it's updated, and the residency website space is varied in quality, as it was when I was training. Ours is up to date and looking pretty good. And so we encourage people to start there. There certainly will be other questions. And that's when, reaching out to myself, to program directors Kevin O'Connor, Craig Ravito, Dorothy, anyone there will be able to comment on additional specific questions you have about the program itself. But I always encourage people, when you want to hear what it's like to be a trainee here, you have to ask the trainees. And so we encourage people to reach out and reach out to our residents specifically. During the interview cycle, we make sure that there is dedicated time where applicants have time to chat with the residents and we walk away to make sure that all these honest questions get asked, because they're like every place. There's pros, there's cons, there's everything in between. We want to make sure that you find all the information that you need. And so you need to ask questions of all different levels, because truthfully, you may get different answers. And so we need to make sure you have those answers. You get your questions answered properly. So I would say all of the above, certainly a great place to start. Website, Dorothy, and then specific residents.
And we can help connect you with residents. We have a medical student education team of residents who self-select to be frontline, who love talking to medical students about PM&R, specifically about our program, about the field in general. And obviously that team will rotate over time. So if you reach out to me or reach out to Ashwin, we can specifically connect you with residents who actively want to talk to you, especially.
So Dorothy, I want to go back to the comment that you made about letters of recommendation. Who should students be seeking letters from? How do they go about expressing an interest in PM&R, a genuine interest in PM&R, to their letter writers who may not, necessarily be PM&R doctors writing letters of recommendation for them? And then, what sort of pieces of information should the students be encouraging their letter writers to include in those letters to help put the student in the best light?
Great question. So the most important thing about a letter of a recommendation is that it is a strong letter and it is a specific letter. So you want to make sure that you have letters from folks who know you well, can speak to your strengths and give examples that really illustrate and help us to see really who you are through the lens of that letter. That said, you're going to ask for letters from folks who span a range of specialties. If you've worked closely with a physiatrist, that's really helpful because they can speak to the details of our field and the way that you fit in as an applicant. For non-physiatrists, you may need to do a little bit of education, what the field that you've chosen, why you've chosen, what about it appeals to you, and maybe share some examples yourself that you've experienced and what those have meant to you and what you've learned from them. And then be proactive and confident in asking your letter writers if they feel comfortable writing you a strong letter, and if possible, could they comment on some of the characteristics that we've talked about? Could you comment on my ability to work in a team? Those kinds of things. Ashwin, other thoughts?
Nope, I think you hit it right on the head. Yeah, PM&R letters are great when you can get them, and other than that, they have to you want to be strong and specific. So exactly right.
So another huge component of the application is the personal statement. And, when we did our webinar for orthopedics, the program director, Dr. Bono, mentioned how many times there's a story that goes along with it that doesn't really actually talk about the student. And he mentioned, when I was 12, I fell out of a tree and broke my arm. And ever since then, I wanted to become an orthopedist. Not necessarily the strongest personal statement. What do you all look for in a strong personal statement? What is it that catches your eye and makes you more interested in learning more about the applicant when they apply to your program in that personal statement?
So yeah, I think we see those a lot, right? It's usually it's somebody in the family maybe had a stroke or something, and then they met a physiatrist and truthfully, some of those stories can be quite compelling as long as it's tied in to an understanding of the field. The fact of the matter is because PM&R is so broad and because it's sometimes hard to get to specific rotations, in a very different way, the personal statement is this window into the applicant and what the applicant's understanding of physiatry is. And so it's a great place to kind of show off that you understand the focus on function. You understand how physiatrists think a little bit differently than some of the other folks that you worked with in different rotations. And, and demonstrating that is that thinking or the philosophy behind it maybe is what appeals to you, that sort of stuff, that seems to carry a little bit more weight. It seems to make it more compelling. Sometimes there's stories that really just don't tie much at all and aren't super helpful. And sometimes they're ones that are a little more compelling. The big things to me with personal statements are they need to have a glimpse as to who you are as a person and do something or tell us something that's not in the rest of the CV. The personal statements that are recitation of the CV in a paragraph form aren't super useful. And they have to be proofread a lot. And so make sure that someone else reads your personal statement and, make sure it flows well. Those are kind of the big things for me. Anything else, Dorothy?
All the same. The one thing I'm sort of thinking about as we are thinking about personal statements is to think about sharing with the program what you will offer. A lot of times, and reasonably, students will talk about, I think your program is great because of all these things. This is what I want from your program. This is what I like about your program. But as the program, tell us what you're going to bring to our program. How do you envision yourself fitting in here? And what strengths are you going to bring to us that will enhance our program? So it's okay to speak about yourself in that context, and it's helpful for us to hear your view of how you're going to fit in with us.
And so another thing that's popping up in this application season for many programs is program signaling. And so Ashwin, can you tell me what are your thoughts around how to approach this? Maybe even give a little bit more of a background as to what the program signaling is going to look like for PM&R specifically.
Yeah, so the first thing I'll say is that this is continuing to evolve. And so everything that I say now may not be valuable in a year, or it'll probably be so close, but our utility of how we're thinking about these signals is brand new. And so it is continuing to evolve. What we found last year is we got a lot of signals, which is great. And, what I think it tells us is that there's a lot of play, and it tells us there's a lot of folks who are particularly interested in our program for a variety of reasons. You can signal in a couple different ways, one of which is you can provide a geographic preference. You can provide actually an urban or rural preference, and then you can signal a specific program. And so the advice that I've heard just kind of talking to students has varied around kind of across the country. Through the AAP and the AP&R, the thought was that there are, Dorothy, correct me if I'm wrong, I believe we decided on 4 signals, and one of them should go to your home program if you're interested in going to your home program. And that gives you 3 other signals to provide, at other areas where you are particularly interested. And we certainly pay attention to them. It tells us that this is an applicant who is particularly interested in this program. I think they're also very useful if, for instance, we see folks who, for instance, their family is from California. They grew up in California. They went to Stanford Medical School, UC undergrad, and they're thinking about and their fiance and dog are both in San Francisco, but they really want to come here to our program. Right? That might be a place where they're probably not going to want to come all the way across the country, but a signal tells us, okay, hang on, this actually is someone who would be particularly interested in coming across, despite some maybe other suggestions that this would be it. We try not to look too deep into some of these things because it is very difficult to kind of pin this to a specific, predict a particular applicant's interests without them expressly stating it. But a signal is a good way to kind of make that declaration that your program is interested. So what I'll say is we certainly do pay attention to it. Once we're starting to rank people, I would say maybe it has a little less value than everything else that we've seen, the rest of the application, the interview process, all that. But it certainly is a great way in the beginning to let us know that this is, particularly interested in our program.
It's interesting because in years past, it was you didn't need to signal your home program because you wanted to save your signals for the other institutions. And I think that's a big difference for this year for many of the specialties where even your home programs are going to get a signal if you're interested in going there for next phase of your training.
My understanding is that there was a discussion about going to 3 or 4 signals. And initially the thought was just to do 3. And then they added the 4th just for this exact problem to just, okay, fine, take an extra signal, give it to your home program. That way that way it understands. I think that was kind of the thinking behind it.
So this question is for you, Dorothy, and Ashwin. I would love to hear your thoughts. Programs are all talking about holistic review and their efforts to really focus in on getting to know the whole applicant as opposed to focusing on scores. Step 1 is pass-fail, and I'm assuming that the majority of applicants that you all are going to see this year are not going to have a scored step 1. But step 2 is still scored. And so what are your thoughts on how step 2 is incorporated into this holistic review for applications to PM&R?
Ashwin, I'm going to let you take this one.
Yeah, sure. So the short answer is holistic review is nothing new to the physiatry world. We've kind of done this forever. We've never really had huge stock in step scores. I think, part of the reason that it is pass-fail now is a lot of the literature has demonstrated the one thing it does very well is predict your ability to do good on another test and not a ton else. And so for that reason, when we have folks who have high scores, it's great, they're probably going to pass their PM&R boards. So that's good news. But other than that, we really look for all the other stuff that we've been talking about. And so, I wouldn't, the step 1 scores are all going to be pass-fail. I think we will still pay attention to step 2 scores. Particularly, I think what's very valuable is folks who perhaps don't have the best overall academic package for whatever reason. A very high step 2 score might demonstrate someone who is academically very strong, but just for whatever reason struggled in, had a tough time on particular rotation or whatever it may be. So maybe there's a role where that kind of adds a little something, but it is certainly a relatively lower. It's not something that's looked at quite as strongly. What we found is folks who have overall done very well have had higher scores. Those two seem to correlate reasonably well, but we can just see the higher scores through the rest of their like shelf exams and the rest of the rotation evals and things like that. So, I guess the short answer to that question is we will certainly look at the step 2 scores. It will not be the most important factor to the eval. It was never the most important factor in PM&R, and it certainly will continue to not be.
And just in general, are there any other unique components to an application to PM&R that may differ from other applications to other specialties?
I'm not sure. Does ER, for instance, have the supplemental application? Do you guys have that? I don't know how.
There are some specialties that have used it. A lot of them actually moved away from the supplemental.
Oh, okay.
Sort of a 1 or 2 year and then done in process.
Got it. So, as far as I'm aware, they still exist. There may be, that also can be up for debate, truthfully, in the physiatry world. The supplemental application is interesting because because it's so important for us to kind of get to know the applicant kind of on a personal level and interpersonally, and some of the other soft skills that they bring, which are so important in PM&R. The supplemental application is actually kind of a useful way to at least tell us what the applicant thinks is most important about their application, right? Here are the couple things that I've done. A lot of our students they're so darn accomplished. All this stuff that's here. Here's the stuff that I think really highlights who I am. And I think that's actually pretty valuable. And so what I'd say is put some thought into what you put into the supplemental application piece. Certainly during the last year's set of interviews, we paid quite a bit of attention to it. And we saw what students put forward and kind of how they described those particular experiences. And I'd say, I don't know how unique that is to PM&R versus others, truthfully, but I'd say that's at least an important one. It was an important one last year.
And, the big question is how are interviews going to be held this year? Are they going to be virtual? Are they going to be in person? Has a decision been made sort of from the PM&R perspective on a national level, or is this going to be something that's made on an institutional level?
As far as I'm aware, it is suggested virtual, but I don't think it's been dictated to us as of yet. Although truthfully, this is constantly being discussed. And so, interview season will obviously be starting in just a few short months, and we'll have a definitive answer before any of this starts. And we'll certainly communicate that to you and everyone over. But my guess is it's going to be virtual again, at least this year. Awesome. And I think mostly for reasons of just equity across. It is not the same, for folks who are relatively, with means to travel and go to all the interviews and things like that versus others. And so out of sheer fairness alone, I think we're erring towards sticking virtual for at least this year.
Awesome. So Dorothy, when I was applying to residency, the big thing was to send everyone that you interviewed with a handwritten note saying thank you. And at least an email to the program. What are your thoughts on those post interview communications, and how are you advising your students to go about engaging with programs after the interview process?
I think sincere follow-up is valuable. A note, whether it be handwritten or via email to the folks that you interviewed with, is a common courtesy. And I think it is worth doing. I don't think it is required. I don't think it substantially changes your odds of being ranked or any other kind of judgment about you, but I think is good professional practice. That's why I talk about it with students. Ashwin, what are your thoughts?
Same. Polite, we get them, we acknowledge them. We are very careful about our replies to them. So don't be discouraged if you don't hear anything back or anything. That's, just trying in the interest of trying to be fair. We certainly not replying to tons of them. Email is totally fine. Do not feel like you have to handwrite a note. And yeah.
And along those lines about how you are very cognizant on the wording that you use in replying to students, what do you do when you get that email from a student who says, oh, I'm going to rank you number 1, or I'm going to rank you highly? Does that impact anything on your side of things when you are creating your rank list? Yeah,
no, it's a great question. It is great to hear. We love hearing it. a lot of these communications run directly through our program director, Kevin, and our chief residents. And again, being very careful. The rules are very clear and very strict. We will never ask where you're being ranked at any point. And so we're also very careful as to how we reply to it, just to make, it will be neutral. That's normal and expected. It is not something to be concerned about. It's nice to hear it's not necessarily going to bump anyone up, or anything like that. It is, what we do is, we want to have happy residents. And so knowing that a resident is particularly interested in this program is great. And it's certainly something that we acknowledge and we look at, but I don't want to give anyone the impression that, you have to rank number one in order to, to be matched or something. That's certainly not the case.
And Dorothy, on your end, when you're advising students and they're putting together their rank list, what advice do you give students to fill out their rank list and figure out which program gets ranked number one and which program gets ranked number 2 and 3 and so forth?
So we always talk about only ranking programs where you could see yourself. Don't rank safety programs where if you were to get it, it would really majorly disrupt your life and you would be very upset. So only rank places that you physically could see yourself being. Think about what places give you an instinct or a warm feeling, like really use your judgment, number one, and then take into account all of the factors of your life. Where is your family? What are other important factors to you? What would it mean to move to another city? And make sure that you're making an adult decision about next best steps for you that take into account a lot of factors. So it's more of a conversation rather than a specific formula.
And I'll just to echo just a very important factor is the fit of the program and the place is really, really what's important. We will do everything to kind of set our trainees up for success, but we want to make sure that they're in the right spot and that they, we try to be as transparent as we can about our culture and about what the residents are doing and how they get along and all the things, but we want to make sure that we're picking the right people to fit in. And so, ask the right questions that you need to ask and go by your gut instinct. And the important thing to remember is, all the programs like university have very strict standards to make sure that you're getting the education that you need. And if the correct answer, is not always dictated by proximity rankings or anything like that, right? That is not at all a good system. It is what is the right thing for you. I think Dorothy says it very well. You have to make a real adult decision about what's the right place for you.
I think in the end, you have to go with your gut. You can come up with as many algorithms as you want in ranking and coming up with scores and systems. But I think, there's a positive response and a negative response that you have with each application or interview process. And when you're seeing a program from the inside during those interview days, that's a lot of telling information. So don't ignore that gut feeling with the match. We've talked about a lot of topics, everything from the basics to why PM&R to the interview process and everything in between. But I wanted to make sure we took time to see if there's anything else we missed. And I know, Dorothy, you do a lot of student advising. Are there other questions or other topics that you think we need to make sure that those students watching this have, they have that take home with them?
Good question. We covered a lot in a pretty short amount of time. I think we covered the core topics that we would normally cover. Ashwin, what do you think?
Yeah, no, I agree. I think we hit all the main points that we need to. I was just checking, Dr. Landry, in the chat here. It looks like we have a question that maybe we can address in the last few minutes here. It says, can you again briefly describe what skill set we should acquire in our medical education? Connection was poor. Dorothy, do you want to kind of comment on that piece, and then I can?
Sure. Skill set to acquire while you're in training before you jump into PM&R. Very important to have a broad and strong clinical foundation. So pay a lot of attention and do well in medicine and surgery. You need to know about adults and about kids. Try to explore clinical areas that are related to and often integral to PM&R, like neurology, neurosurgery, orthopedics, rheumatology. Even emergency medicine is relevant. A lot of the patients that we take care of may be generally medically stable, but we can also encounter emergencies. Even though our rehab hospital is not an acute care hospital, our patients are still in the medical system. So it's important to be able to know when our patients are sick or not sick, when do we need to engage other people in the acute emergency care of our patients. So broad, strong foundation. In terms of skill sets that are important to acquire, try to find opportunities both clinically and extracurricularly to take care of and or work with patients living with disabilities of all types. A lot of the patients that you take care of in PM&R, and a lot of what we pride ourselves on as physiatrists, is being really strong clinicians for people with disabilities and strong advocates. So familiarize yourselves with some of the considerations that happen when our patients need help navigating the healthcare system, and we need to make sure our patients get access. What are the unique health concerns that patients encounter? So familiarize yourself with that, those kinds of factors. You also need to be able to work really well on a team. So get yourself in situations where you're working with lots of different kinds of teams. Know who the different players are on the team. What are other folks' roles and responsibilities? How do you interact with them as the physician player on the team? And then get to know your supervising faculty so that they can speak to some of your own characteristics that meld with these things. So good clinical foundation, strong teamwork skills, understanding of our patient populations would be the core skill set.
Awesome. Ashwin, any other parting advice that you have for students interested in following in your footsteps as a PM&R physician?
No, I think we talked on all the important things. I think just enjoy the process. You know, physiatry is an awesome field. It's incredibly rewarding. You know, I give one of the graduation kind of addresses at the end, and I always like try to end with this thing. You know, remember kind of the mission and what we do. You know, we will learn to take care of patients in a way that other people won't think to do, or you know, don't have necessarily the skill set to do. And so that's a really incredible and a valuable thing to have. And so enjoy the process of attaining those skills and enjoy kind of putting it into practice and taking care of people. It's really an incredibly rewarding field.
Awesome. Thank you. Well, I want to say thank you to our two panelists, Dr. Babu and Dr. Tolchin, for joining us. This has been a really insightful discussion, and I definitely learned a lot about the PM&R residency process, application of residency process. Lynn, if you could pop up our closing slides. So as I mentioned, we are doing this under the umbrella of the Visiting Clerkship program. We are still taking applications for students who are interested in rotating with us, both in the months of October and November. And you can see the deadlines are on the screen. So deadline is rapidly approaching if you want to come in October, and our last month that we host students is going to be in November. Next slide. Our Harvard affiliated residency showcase will be on Saturday, September 9th. It will be a hybrid event. So if you're able to join us in person, that would be great. Otherwise, we look forward to seeing you online. Information about this webinar, as well as other webinars that we've hosted, will be posted on our website, and you can click on our link to find out more about our programs. And last but not least, we have the very brief survey. If you can click and fill that out. And we thank you for your time. And again, thank you to our presenters, and thank you to Lynn for organizing everything behind the scenes. And with that, everyone have a good afternoon, and enjoy the rest of your day. Take care.